So we are hearing extremely disturbing reports of violence and intimidation outside various government hospitals. This, of course, started on Monday. NAHAWU, the National Education, Health and Allied Workers Union, is on strike despite an interdict to stop them from going on strike. But it's the level of anger and destruction that seems to have accompanied the strike that is really worrying. Just that report just a few moments ago from Stanger about a young critical patient arriving at Stanger Hospital and some striking workers, I have to stress not all, trying to pull her from the ambulance, even assaulting a paramedic. Doctors and non-striking health workers are trying to get to work, but sometimes having to dodge furious protesters in the process. NAHAWU says, don't blame us. We tried to negotiate minimum service level agreement with government to keep the strike safe. Well, let's speak now to the Health Department. Hospital Services Deputy Director General, Dr. Percy Mahlathi. Dr. Mahlathi, I want to thank you for your time. We're hearing sporadic stories which are exceptionally disturbing. I've just been speaking to Keith Pillay of a private medical rescue ambulance service and what they experienced outside Stanger Hospital today. I'll just recap because I know you weren't able to hear the interview, but it's a young girl in a critical condition. As they arrived at the hospital, someone tapped on the window with a panga, then assaulted a paramedic outside, who's standing outside the ambulance, accusing them of trying to secretly get staff into the hospital inside the ambulance. When the ambulance opened up and they realized there was a critical child, even then, some of the protesters, not all, tried to pull this child out of the ambulance. Luckily, she's in hospital, she's stable. But an exceptionally volatile and worrying situation. That's just one example. I'm asking if you can give us the big picture of what is happening at hospitals. Just where are you most concerned? Just how bad is it getting?
Well, thank you, Sally, and thank you for providing us this opportunity to engage. The situation is quite dire, and certainly today was worse than yesterday. And a lot of activities seem to be focused, mainly the epicenter being Gauteng hospitals, then the Free State, the Eastern Cape, and KwaZulu-Natal. And in many instances, I think the one that you've just relayed about the ambulance is really horrific. And that's normally what happens when a strike is leaderless, where you actually get leaders who abdicate their responsibility to make sure that the strike does not go overboard. What has been happening in some of the hospitals is that people have been blocking gates, burning tires. But what is most worrying is a situation where very sick patients would be denied access to available care in the manner that doctors and nurses would be locked outside the gate. And what we're worried about is those very sick ones, the ones that were fairly stable were discharged to the care of their families, even though that could have been premature. But those that actually were just post-operation, others in ICU, there had to be measures, taken. Otherwise, all in all, is a dire situation, which we hope that sense will prevail amongst the leaders of the strike, because this strike, as long as the NAHAWU leadership is actually encouraging, where the strikers to conduct themselves in the manner that they do, there is no way that I think we'll see any turn back. And by the way, this strike is not a health sector strike. It's a general public sector strike, which unfortunately it seems the union leadership decided they will target health, and health being hospitals, because that is where the most vulnerable South Africans are, those who are fighting for their lives.
So bearing in mind that it's a public sector strike, as you say, focusing on health, what is the role of the health department here? Is it kind of out of your hands, or is there a role that you're playing?
Well, look, I think as the health sector, we've got internal problems that we have as the health sector, including funding, infrastructure, improving conditions, and all that. But all that does not warrant that people should really put in danger the lives of those whose lives are already compromised. I think for the health sector really is for us to focus on limiting the damage and continuing with the attempts that we've been making to improve, the conditions, so that our staff can be able to have the necessary tools of trade for them to be able to do the work that they're employed for. DPSA on behalf, that is Department of Public Service and Administration, on behalf of government, is the one that is leading with negotiations at the bargaining council. That is why we really don't understand why of all government, institutions, it seems is actually, the hospitals that are targeted.
I have to ask, to your knowledge, I mean, obviously you're still assessing what's going on and getting reports from various hospitals, but so far, has the strike and some of the intimidatory tactics that have been carried out, has it caused any direct loss of life at the hospital as yet? Do you have any reports of a critically ill patient being barred and then dying, for example?
Well, Sally, I think we should give credit and really appreciate the professionals that have been dedicated and decided that against all odds, they are going to stick to their ethical obligations and make sure that they go all out to save the lives of patients. So far, we have not had any patient who would have lost their lives as a direct result of the actions over the past 2 days. That does not mean that there would not be any. Clearly, there are a number of them whose recovery has been compromised because some of them have gone for more than a day without food because the kitchen, could not be working. Yeah.
So you said a little earlier, in comment on what happened to that little girl in the ambulance at Stanger, that is a sign, it's a leaderless strike, that there's no order, there's no one pulling everyone together, that NAHAWU needs to be controlling its members. But, isn't it a loss of leadership on a number of levels? I mean, I'm trying to get an understanding, I know that the hospital or the health department isn't directly involved, it's public service, but can you confirm that there are high-level meetings with the police departments, health, and with public service? Because this, as you say, is a dire situation, potentially life-threatening. Is the leadership on that side also getting together saying, right, what can we do to deal with this strike, to manage it as carefully as possible? Are those meetings happening? Or is there a leadership vacuum on that side of the story as well?
Let me start by saying, Sally, that some of us were involved in leading or conceiving strikes before 1994.
Yeah.
And one of the things that we used to do in the health sector was to make sure that there is enough what we term skeleton staff, so that you don't leave patients alone while others are actually out on strike. So we made sure that there is no damage that is, that gets, experienced by patients. Coming to the part that you've asked, certainly there's been engagement. In fact, our Director General for the past 2 days has been in constant touch with the National Commissioner of Police and the Provincial Commissioner of Police. And our minister has been engaging the Minister of Police, Mr. Begekele, because Dr. Pasha has always been of the view that we need to do the best that we can within the health sector and then get support from outside on areas that we do not have competence on. And the areas that we don't have competence on is actually providing safety and security. So there are discussions at that level. I'm aware that, although I don't know the detail, but I'm aware that Cabinet actually has been reflecting on this particular matter.
Well, that's good to hear. I want to get a response from you, and I'm not sure if you can comment, because I understand the position you're in as the health department. But one thing that NAHAWU is saying is that if anyone dies because of this protest action, it's not our fault as strikers. It's actually government's fault, because we've been trying to get them to agree to minimum service agreements, which is essentially agreements that provide for essentially what you're saying, skeleton staff, minimum services while other members go on strike. He's pointing a finger directly at government. Who would agree those minimum service agreements? Would it be you as the health department, or would it fall back to the public service department?
Well, first of all, Sally, the absence of a minimum services agreement does not give anybody to endanger the life of somebody else, especially those who already have got their lives compromised lying in hospital. Now, minimum service, all agreements are actually negotiated and discussed at the bargaining council. To make sure that there is uniformity in government, the Department of Public Service and Administration leads, with that kind of discussion. But certainly when it comes to the Department of Health, as far as the essential health service workers, we're not the only ones that would have essential, workers. Police is the same and many others. But for us, then we would be expected to provide leading input. That would then, because some of the issues are quite technical, and the various divisions in the health sector are not the same. Some are very technical, some are very general. So that is where it would be. As to whether, discussion stalled because of whatever reason, I'm not sure. But certainly, once the dust cools down, I think it would be important that we actually get back to that. And I don't think it's only because of government that has not moved. Like they say, it takes two to tango.
To your knowledge, has any protester been arrested for destruction of property, for breaking the law in the past 3 days?
Well, I know that 3 protesters in the Free State were arrested.
Okay, so 3 people arrested so far. I want to end by asking for your advice, not only for patients, for people who might need to go to a government hospital overnight or tomorrow. Should they try not to go? What is your advice to people who are in an emergency situation and need hospital attention? And also advice to health workers who are not on strike?
Well, I would start by saying for people that need emergency care, remember that our law requires that both public and private institutions do not deny people that need emergency care. So certainly, I'm sure the private hospitals would be willing, to really take those people, stabilize them. But for those that may not be in emergency situations, I think just for safety reasons, it would be good to establish, with the nearest facility as to, whether, it would be safe to visit. And I would not say that people should actually stay back because of the fear of getting to hospital. Many of the, facilities, especially the late afternoon, evenings and all that, become calm. And so far, the assurance that we've received from the Ministry of Police, from the commissioners of police, is that for the areas that we've identified that seem to be, quite intense areas of activity, they would be able to send reinforcements. And certainly, I think it's the duty of the police also to make sure that whoever goes to the health facility seeking, healthcare, they would be able to do that safely.
Do you feel let down by the police?
Well, I think, Sally, let's be a bit pragmatic.
No, tell me, because, I mean, it's your hospitals, and then you're seeing people,
yes.
Their lives being threatened, hard-working people who just want to work, patients who are critically ill. Doesn't it make you, I mean, obviously, Nahawu, that's one issue, but the police are actually there to step in when things go wrong. They don't seem to have stepped in enough.
Yeah, well, look, I think the response from the police has been variable. There are instances where police, have acted and calm situation well, and Baragwanath is one of those. I was there. But when you actually just go across less than 10 kilometers, at Begimlangeni, there was no sight of police, even though the police station is next to the hospital. So the response has been variable, certainly not satisfying, but we would like to see more, intense and urgent, response whenever police are called.
Okay, so thank you so much for chatting to us. Really do appreciate it. Explaining there that you are not satisfied with the police response. It has been variable, sometimes no police presence, but confirming to us this evening that there are high-level government and cabinet talks underway to try and deal with what is going on with this Nahawu strike. Thank you so much, Health Department, Hospital Services Deputy Director General, Dr. Percy Mahlathi, also telling you that if you have a medical emergency, a life-threatening one, remember, private hospitals have, by law, a duty to stabilise you. And if you're worried about government hospitals at this time, that's the place to go. Also saying that in the evening and overnight, it tends to be a little quieter. Let's hope this situation is resolved quickly because, as he said, it is very dire indeed.